We heard from our Chief Medical Officer of Health, Dr. Moore, 2 weeks ago, and again last week, that we were fast approaching a time when we could safely remove restrictions. Over the weekend, I received recommendations from Dr. Moore on a plan to safely reopen our economy and remove Ontario's vaccine passport system. I've accepted these recommendations, and so today I can announce that beginning on February 17th, we will remove all capacity limits except for sporting events, concert venues, and theaters, which will be capped at 50%. Some higher risk settings will also be capped at 25%. Social gathering limits will increase to 25 people indoors and 100 people outdoors. Organized public events will increase to 50 people indoors with no limits outdoors. Effective March the 1st, we intend to eliminate capacity limits in all indoor public settings. At the same time, and at the recommendation of Dr. Moore, we will lift proof of vaccination requirements for all settings. Based on the advice of Dr. Moore and what we have learned over the pandemic, we will need to keep masking in place for just a little bit longer. This is an important layer of protection that will allow us to proceed with our reopening plan safely. My friends, like all of you, I've waited a long time for this news, but please never doubt that the steps we took together, as difficult as they were absolutely necessary and saved tens of thousands of lives from COVID-19. And we're here today, we're able to take this step now because of each and every one of you, because of our nurses, our doctors, hospital workers, because of every single person who volunteered in a vaccine clinic, and every single person who played a part in this fight. And let me be very clear, we're moving in this direction because it's safe to do so.
All of the metrics are improving dramatically in terms of the number of people hospitalized, the number of people in the intensive care unit, the percentage of tests that are positive. So we'll continue to monitor those data sets as well as the ongoing availability of PCR to make a decision on masking. As you know, we've always moved public health measures in a staged, phased, and evidence-based approach. So we're opening up on the 17th, again on the 1st, and after that time period, typically 2 weeks thereafter, we'll review all of the data and make further decisions on any other public health measures.